Are you dealing with urgency, leaking, prolapse, which is a bulging sensation on your vaginal canal, diastasis recti, which is a gap on your abdomen, pain during intimacy, chronic pelvic and low back pain? If you feel like your body has changed and you don't know how to fix it, you aren't alone. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be demonstrating a lovely program to finally fix your pelvic floor issues. 6 to 8 weeks. It can be a powerful turning point, not just physically, but mentally, emotionally too. You'll be surprised how our pelvic floor handles our emotions, how it could make a big impact in our overall health, how to activate our deep core muscles. There's nothing more frustrating than looking in the mirror and wondering why you don't feel like yourself anymore. Your tummy sticks out, your ribs feel wider, your core is weaker, difficult to engage, you have difficulty lifting your babies or doing household chores, and your hips back always ache. I get it because I've been there too. I had 2 babies, I had 2 C-sections, I had car accident with fractured chest, SI joint dysfunction, weak pelvic floor, leaking, pain during intimacy. That's why I created the Core Back Collective to handle all of those issues in a one big community. The Core Back Collective is an amazing combination of my core back immersion therapy for the pelvic floor issues and the core back protocol for back pain relief. It will treat your back pain, pelvic floor issues, fix your spine, posture awareness, and deep core activation. But the truth is clear. Your spine and your pelvic floor are interconnected. When one is compromised, the other is affected. It's like one part of the coin. You feel like your pelvic floor is off, then your back will be off. I've seen it over and over again. Inside this community, we don't just treat symptoms. We address the root cause of your problem. So I'm so excited. I just launched my Core Back Collective through years of doing my physical therapy, evidence-based science, Pilates, yoga fused together, relieving your chronic back pain, pelvic floor dysfunction. I provide the tools to help you succeed. We use a bowel bladder diary. I will do proper assessment, know your root cause of your problem, learn the behavior and hygiene of your pelvic floor, the patterns, the unique patterns that's specific for you, so I can specifically target it with our Q&A, weekly Zoom calls with me. I'm so excited. I just launched it inside my school community, and this is going to be so convenient for me to address all of your problems and be easier to connect with you so we can fix it together. You have access to all of my gentle follow-along videos, step-by-step guide system inside my program, where the core back protocol is for my back pain relief patients and my core back immersion therapy for my pelvic floor issues. They all interconnected. You'll be surprised how important to address everything in one go. But the good news is it's easy to follow along, 5 to 15-minute daily routine that you can start right now. We don't just jump start to a heavy core workout. We slowly progress, and that's the beauty about my program. You start releasing the tension first, learn how to connect to your pelvic floor through breath work, core engagement, ribcage alignment, pelvic floor issues that you can finally feel the connection. We'll do gravity-assisted exercises with the foam roller, with the wall, with the ball, and everything you need. So in this video, I'll show you some demonstration that you can find inside my program. We'll be utilizing a 2-pound dumbbell. And if you don't have a 2-pound dumbbell, you can still join me. We're gonna release your tight thoracic spine. Why the thoracic spine affects our pelvic floor? If you have a forward head, rounded shoulder posture and you have limited mobility, it creates this pressure on your pelvic floor. The vagus nerve, it will calm the nervous system with the proper breath work, open this vagal connection, reconnecting the system and building that core, deep core functional core strength. And what will be the results? When your body starts working as one unit with the breath work, the diaphragm shifts down to, as you inhale, the pelvic floor eccentric control releases, and then as you exhale, it lifts up and the ribcage is finally aligned. Your tummy becomes flatter, your waist becomes more defined, your clothes fit the way that you haven't felt before. Of course, nutrition is important. Walking is one of the best way to our pelvic floor, so I recommend for you to start walking 10 minutes after each meal. breakfast, lunch, and dinner, and guess what? You already did your 30-minute pelvic floor strengthening by gentle walking. Good for your back pain, good for your heart, and mental health as well. So you're ready to reclaim your core back and your pelvic floor health. Click the link down below. Join my Core Back Collective. I'm so excited. I just launched it and I have so many students already inside. I can't wait to meet you in my weekly Zoom calls. I do everything inside step by step, from beautiful videos I created through years of evidence-based science of physical therapy as a pelvic floor health physical therapist certified, brain injury certified physical therapist, and Pilates and yoga instructor. Also, for those who already joined, we are kicking off the Core Back Protocol first weekly call this Saturday. So don't miss out. Make sure your bowel bladder diary is already filled up. Email it to me or message me inside our school community so you can see what's going on. So I could also see when you answer those for 2 days only, I could give you the right feedback because each one of you has your unique experiences and things that you've been doing that creates more spasming, disconnection, and irritation on your bladder and bowel that connects to our pelvic floor. We will discuss what to anticipate this upcoming week and how to prepare for our live Q&A. So now let's begin our workout. Let's get to work and let's fix that leakage for good. Okay, my friends, we're gonna start now. Make sure if you need a soft foam roller, common foam right now, click the link down below. This is my limited edition 3-inch foam roller. The difference between 3 inches is a little bit not as elevated, but it's still unique, and still assisting your pelvic floor. And then the 6 inches is great for anyone with weaker pelvic floor with prolapse. But if you're having back pain, stiffness, and tightness, the 3 inches is a little bit easier on your SI joint. Okay, my friends, let's begin. I'll place the foam roller underneath our pelvis first. So lie on your back. Grab the foam roller and place it on your pelvis, not on your low back. Okay, my friends? So if you place it on your low back, you're gonna hurt your back. Pelvis, not on the hamstrings as well. Pelvis. Okay, my friends? Grab the foam roller, place it there. Make sure it's soft. If you don't have a foam roller, you can use roll towel. We're gonna do with breath work first. So most of my patients with pelvic floor issues, their ribcage are flared open. They have anterior pelvic tilt. Their abdominal muscle starts bulging. We want to start connecting. You can use your hand to give that mind-body awareness. Hand on your abdomen and one on your chest. You want to make sure you're not a chest breather. So what do you mean by the chest breather? So most patients, when they do chest breathing, they're actually doing this elevation and they're squeezing and sucking your stomach in as they inhale. That's not healthy for a pelvic floor. And guess how many times we breathe every day? At least 25,000 times. So that's why Kegels are great, but not enough when you have wrong breath work. Okay, my friends, let's start with breathing. As you inhale, you can see I'm doing a 360-degree breathing. I'm expanding anteriorly, laterally, and posteriorly. That's why I love the foam roller. It gives you space and awareness at the back to push out. So you can see everything is opening. And as I exhale, I'm going to use my hands, my thumbs at the back of my posterior rib cage, the side of the web of my hand on the lateral rib cage, and my index on my anterior rib cage. So as I said, they're stuck on this anterior rib cage flare. We don't want that. So as you inhale, you want to expand this way. And then as you exhale, you gently zip it up from your lower abs to your navel and then compress. I'm using my hands to really release the air so my diaphragm goes up and my pelvic floor lifts. Again, inhale, expand. Exhale, squeeze. Breathe in, expand. Exhale, lift. Zip it up. Without moving our pelvis like this. If you started compensating by tilting our pelvis back and forth, that's not real core engagement. You're just using hip mobilization lumbar mobilization and tilting our pelvis. We don't want that. We want to keep our spine in neutral position, a little bit arch on your back, not hyperlordosis, which is overarching. We want to keep it stable. Again, inhale, exhale, zip it up. See if you can see, I'm not really moving my pelvis. If I place a cup of coffee here, I'm not tilting it forward and back to spill it. Again, last deep breath in. This is so important and crucial to engage our breath work first. And zip it up. Okay, my friends, grab the dumbbells. This will give you that beautiful release of your tight rib cage. So with your hands overhead, take a deep breath. Expand. Exhale, zip it up. Inhale, expand. Overhead reach. So get more air in. Exhale, zip it up. As I lift my hands back to the center, and you might feel shaky. Breathe in. Breathe out. Breathe in. Breathe out. Inhale. Exhale. Now we're going to include our tabletop, which means I'm lifting my knee to my chest to tabletop position as I slowly lift my dumbbells back to the center. So there's going to be a beautiful core stabilization happening. So as you inhale, overhead first, expand, don't forget the expansion and rib cage. 360-degree breathing. Exhale, zip it up. Start with my right knee to tabletop. So my knees are bent to 90. I'm not overextending or not too much bending, just 90-degree bend. And then as I slowly lower my foot down, my arms go overhead. Expand and then switch to the other side. Breathe in. Breathe out. Inhale. Exhale. Inhale. Overhead. Exhale. Breathe in. Breathe. Inhale. Exhale. 4 more. 3. 2. Exhale. 2 more. Last one. Last one. Well done. Now we're progressing with double knee bends. If it's too challenging, then stop. If you feel any bulging sensation, pain, leakage, then you're not ready. Listen to your body. Everyone's unique. Take a deep breath through your nose. Exhale, zip it up and lift both legs up and both arms as well. Inhale down. Tap your toes, arms overhead. Breathe in. Breathe out. Inhale. Exhale. Breathe in. Breathe out. Inhale. Overhead, tap your toes. Exhale, lift. Breathe in. Four more. Breathe in. Breathe out. 3. 2. And 1. Well done. So from this position, we're going to lengthen your hip adductors, the mirror of your pelvic floor, which means if you feel tight on your hip adductors, you're tight inside. If you feel pain when you touch your inner thighs, then there's pain inside. Isn't that something? If you feel wobbly here, and then it's wobbly inside. So this is important to strengthen. So from this position, take a deep breath. Exhale, zip it up. Open your knees apart and your arms apart. Inhale, expand your abdomen as you go back to the center. Knees together, hands together. Inhale, exhale, open. Breathe in. Breathe out. Inhale. Exhale. Breathe in. Breathe out. Inhale. Exhale. Feels so good on your chest muscles as well. 4 more. 3. 2 more. Last one. And 1. Now we are progressing with both legs up to the heavens, toes pointing to the heavens. We're going to do double leg circles. This will help strengthen your deep core muscles. Small circle like a size of a small dish. Keep the dumbbells pointing forward up to the heavens to engage your core as you breathe in and breathe out. Don't forget your breath. Breathe in, expand, exhale, zip it up. Now let's do reverse circle. Breathe in, breathe out. Inhale, exhale. Last deep breath in. Now we'll do butterfly. We're going to do V-stretch, which means we're going to open your knees apart with your feet pointing to the heavens. Keep them locked. Don't just like do this, making sure you're really engaged by toes curling in, like curling your toes to flex, to engage further. As you inhale, exhale, separate your arms apart and separate your feet apart and breathe out. Once you reach this level of a deep stretch on your hip adductors, dorsiflex your ankle, point your toes towards you, flare it, open your toes apart to really stretch. Breathe in and back to the center. And once you reach in the middle with your hands together, toes pointing to the heavens again to plant or flex, tippy toes. As you breathe in, breathe out, open. And once you feel the stretch, inhale, dorsiflex, open your toes apart, stretch your toes, separate them apart. Breathe in, exhale, back center. And then once you reach in center, tippy toes, inhale, exhale, open. Inhale, dorsiflex. Breathe in, breathe out. Inhale, exhale. 4 more. Inhale, exhale. 3 more. 2 more. Last one. Well done. Now let's do our ribcage opening and strengthening. Thoracic mobility is so important for our pelvic floor health. So all fours position. Let go of the dumbbells. Grab the foam roller for assistance on your wrists. Most of my patients with pelvic floor issue, they have weak wrists, especially for hypermobility. Take a deep breath through your nose. Arch your low back. Tilt your pelvis in to an angry cat. As you breathe in, breathe out. Look up to a camel or cow as you exhale. Inhale, round your shoulder. Look down towards your pelvis. Inhale, exhale, look up. Feels so good on your back. Breathe in, round. Exhale, look up. Breathe in. Breathe out. Inhale. Exhale. 4 more, my friends. Inhale. Exhale. 3 more. 2. And 1. Now I want to make sure you stretch your upper back by rolling the foam roller down, lower your hips down. This is good for your thoracic spine. And rest and hold this for 2 deep breaths. Breathe in and breathe out. Well done. Now grab the dumbbells. We're going to do some thoracic mobility. Most of my patients are very tight on their thoracic spine. So the dumbbells are a little bit of a challenge. If you find the dumbbells too challenging, let go of it. As you breathe in, breathe out, lift the dumbbells up to the heavens and look up and stretch those thoracic spine. That thoracic spine is really tight. Usually of most of my patients, they rounded shoulder. They can open with their chest out. As they breathe in and breathe out down. And then take a deep breath and exhale, switch to the other side. Feels so good on your rib cage, all the way to your hips actually. Inhale down, exhale, switch. Breathe in, breathe out. Inhale, exhale. Breathe in, down, exhale, switch. 4 more. Inhale, exhale. 3 more. Inhale down, exhale, switch and lift. 2 more, my friends. Last one, inhale, exhale. Okay, my friends. Now we're gonna do some downward dog. Downward dog is a great tool to help your pelvic floor tightness and strengthening your core at the same time. If you find yourself leaking stock or any bulging sensation, take a deep breath through your nose. Exhale, zip it up and grab your toes on the mat and lift your knees off. Use the foam roller for stability, especially this is very soft, so it's easy on my wrists. And then making sure your heels are down on the floor. If your tippy toes like that, you're really tight. So you want to make sure you pedal left and right to lengthen your tight hamstrings. As you breathe in and breathe out, stability with the foam roller. Hold it for 10 seconds with your breath work. Feels so good on your back, your thoracic spine, and your hamstrings and calves. and press down as much as you can. And then slowly go back to all fours to rest. After 10 seconds. Again, take a deep breath through your nose. Expand and zip it up and lift your knees off and stretch. Breathe in and breathe out. Pedal left and right if you need to. Inhale and exhale. It's good for your thoracic spine and your shoulders as well. Most of my patients have weak shoulders. Last one. Take a deep breath. Exhale, lift. Inhale and exhale. Feels so good in your shoulders, thoracic spine, and back to all fours. Now we're gonna do some thoracic mobility release with the dumbbells. So all fours position. Take a deep breath. Inhale and down to a child pose and lift your arms up to the side and open. And lift back to all fours and then overhead to stretch. Back up. Inhale. Exhale, overhead. Breathe in. Breathe out. 4 more. 3, 2, and 1. Well done. Now switch to the other side. Twist to the right, overhead. As you go, lower your hips down, arms overhead. Inhale back to all fours with your arm pointing to the heavens. Keep looking up. Exhale. Breathe in, breathe out. Inhale, exhale. 4 more. 3, 2, and 1. Well done, and that's it. I'm hoping you enjoyed this lovely thoracic mobility, upper back strengthening all the way to our pelvic floor with proper breath work, core engagement, and gravity assisted. If you find this video very helpful, want to learn more about Pilates, yoga, physical therapy, please subscribe to my channel, ring the bell so you won't miss anything. Like and share this video. Every like you're giving to my channel, you are supporting me. And as I said, you can join my core back collective. It's a combination of my core back immersion therapy and core back protocol where I combine everything I know about Pilates, yoga, and physical therapy fused together. As a pelvic floor therapist of many years, back pain recovery specialists, and if you need my help and you are suffering excruciating low back pain, you can book a free one-on-one call with me. Click the link on the description below and I'll see you inside my Zoom call. I'm hoping you learned a lot and I can't wait to help you reach your deep core goals. If you're perimenopause, menopause, or postpartum ladies, and men who are suffering with pelvic floor issues as well. I've been helping even medical doctors inside my community who are men and suffering. You'll be surprised it's not that hard to fix. I end this video about how to fix your one-sided low back pain weakness if you have quadratus lumborum pain. Until next time, always remember, be safe, be well, and healthy you. Bye!